This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Tussalyte sugar-free cough syrup is an effective remedy for relieving dry cough. It contains dextromethorphan, which suppresses the cough reflex. Indications and uses. This syrup is primarily used to provide temporary relief from dry, non-productive coughs that may arise due to minor throat irritation, colds, or environmental factors. It is effective in reducing the urge to cough, allowing for a more comfortable experience. How it works. The active ingredient, dextromethorphan, works by affecting the signals in the brain responsible for triggering the cough reflex, thus providing relief without impacting the respiratory system. Directions for use. Take the syrup as advised by your physician, shaking it well before each use. Utilize the provided measuring cup or dosing spoon for accurate measurement. It is typically taken every 4 to 6 hours, but always adhere to the maximum daily dosage recommended by your healthcare provider. Possible side effects. Common side effects may include dizziness, nausea, vomiting, and gastrointestinal disturbances. If any side effects cause concern, consult a healthcare professional. Precautions and warnings. Before using the syrup, consult a doctor if you have kidney or liver problems, are pregnant, or are breastfeeding. Avoid alcohol consumption and be cautious when driving or operating heavy machinery, as dizziness may occur. FAQs. 1. What is this syrup used for? It is used to relieve dry, non-productive cough. 2. How does it work? It suppresses the cough reflex in the brain. 3. How often can it be taken? Adults and children over 12 can take it every 4 to 6 hours. 4. Is it safe for children? Suitable for children aged 12 and above. 5. Can it be taken with other medications? Consult a doctor before combining it with other medications. Thank you for watching. If you have any questions or suggestions, feel free to leave a comment below. Your feedback is appreciated.